you feel hopeless, like, please just help me with my baby, you know.
And he was just angry. He was angry a lot, and he spit up.
She continues to not put any weight, doesn't even want to try, and also become extremely constipated and isn't going.
If your child is experiencing any of these symptoms, let me tell you, there's hope. Your child's body was created with all the information it needs to express their full potential, how to heal, how to function, and how to operate. This information is your child's innate intelligence. That intelligence is coordinated through your nervous system. And your nervous system is made up of your brain, spinal cord, and nerves. Your nervous system is communicating with 70 to 150 trillion cells in your body. And in order for that to happen, every message travels from your brain through your spinal cord. Traveling along the intricate network of nerves, reaching the specific cells and tissues in your body. Messages then travel back to the brain, letting your brain know what's happening. Your nervous system is so amazing that right now it's telling your heart to beat, your lungs to breathe, and your digestive tract to process your food. It's also deciphering the words you hear and the video you're watching right now. And you don't have to think about any of it. But what if your child's nervous system isn't working at 100%, and their innate intelligence isn't able to effectively communicate with every cell? Then the vital functions don't happen exactly as they should. Imagine the signal on your cell phone. When you have good reception, you can communicate clearly. When you have poor reception, the communication becomes unclear, and the messages may not get interpreted the way you meant. When you get pressure or irritation on your nerves, it will cause poor reception for the messages going from your brain to your body, and your body to your brain. When the messages don't get communicated properly due to interference, your child can develop symptoms. That makes your nervous system a vital component to your child's health and well-being. Your nervous system is partly protected by your spine. When two or more of the vertebrae in your spine lose their normal position or motion, putting pressure or irritating the nerve, it can disrupt the normal flow of your innate intelligence. That interrupts the communication from the brain to the body and the body to the brain. This is called subluxation. But what causes these subluxations? When a child is subjected to external forces and is no longer able to adapt to those forces, a subluxation can occur. There are emotional, chemical, and physical external forces that can have an impact on the body. Many parents are unaware of these external forces that cause the body to become overwhelmed and subluxated. Dr. Viola Fryman examined 1,500 newborns within 5 days of birth, and she found that 90% of these newborns had suffered birth trauma. Dr. Abraham Taubin, a Harvard University pathologist, researched birth trauma and correlated it with SIDS cases and respiratory conditions. Dr. Gottfried Gutmann examined 1,000 infants and found that 80% had some form of nerve dysfunction. This is very important because 65% of neurologic development happens in the first year of life. Dr. Gutmann went on to say, the trauma from the birth process remains an underpublicized and therefore significantly undertreated problem. With a subluxated spine, your child's communication highway from brain to body and body to brain is no longer working at 100%, and that potentially affects the way they're able to think, behave, how they feel, and how they develop. Even without the symptoms of pain or crying, these subluxations often linger and go undetected after the initial bump, bruise, or fall. Your child's health is the most precious thing in the world. Now is the time to have them check to see if there's an interruption in the flow of their innate intelligence through their nervous system. Chiropractic care for babies and children has been shown to be gentle, safe, and effective. Babies can be checked for subluxation very soon after birth, often within the first hour. How important is it for you to know your child is expressing their full God-given potential? Call our office today to schedule an appointment. Let us help restore the innate connection between their brain and their body so they can express themselves fully with a subluxation-free nervous system. Call today.
He gradually started to improve. And it was so weird for me because I was like, no, it's got to be something else. He's just maturing. But it's really amazing to watch. You watch them get adjusted. They celebrate adjustments, and And it's a really cool thing to watch. And then afterwards you see kind of the comfort level that they have if they're kind of fussy because they've been, they've had a little fall and they've been out for a couple days or whatever.
And that night, she was walking and running around the house, which just blew my mind.
And see her evolve from being miserable, coming in, screaming her head off, and then going to sleep in the car afterwards. She's eating, she's maybe having 6 bowel movements a day, and now I'm like, geez, every day a diaper change. But she's happy. I mean, my husband, he trusts me with, what kind of treatments I would give her, but he was a believer after.